In this video, we're going to look at the region booklet for the shoulder and upper extremity region. So with this booklet, parts 1, 2 and 3 have already been completed. Parts 4, 5 and 6 are still outstanding. For part 4, you need to identify the origin, insertion and actions of the following muscles. Now some of this has been completed, however these first 3 were missed. So you need to do this for the trapezius muscle, for levator scapula and rhomboids major and minor. You also need to identify the origin for latissimus dorsi. For part 5, you need to perform active range of movement, passive range of movement and resistive range of movement for the following movements. So you need to identify which muscles are responsible for this. So if we have a look, you've completed this for shoulder flexion, shoulder extension, shoulder abduction and shoulder adduction. However, you have missed it for glenohumeral internal rotation and glenohumeral external rotation. So for glenohumeral internal rotation, the active range of movement, the client abducts their shoulder to 90 degrees, flexes the elbow to 90 degrees and lowers their hand towards the floor. Passive range of movement, the therapist abducts the client's shoulder to 90 degrees, flexes the elbow to 90 degrees, then rotates the client's arm towards the floor. And resistive range of movement, the therapist resists internal rotation so there is no movement. Glenohumeral external rotation, active range of movement, the client abducts the shoulder to 90 degrees with the elbow flexed to 90 degrees, the hand pointing to the floor and the client rotates their hand towards the ceiling. Passive range of movement, the therapist abducts the client's shoulder to 90 degrees, flexes the client's elbow to 90 degrees, the client's hand pointing towards the floor, the therapist then rotates the client's hand towards the ceiling. Resistive range of movement, the client is in an internally rotated position and the therapist resists external rotation so there is no movement. For part 6, you need to perform the following special tests and identify the objective of the test, the positive findings and how it is completed. So this needs to be done for subscapularis lift-off test, Neer's impingement test, Hawkins-Kennedy test, painful arc test, empty can test, as well as Speed's test and Jurgensen's test. Also crossover test for the AC joint and crank test. If you have any questions with this, please chat with Paula or Emily and we can provide extra assistance.